I'm Annie. I'm a qualitative research associate in the Department of Global Health and Social Medicine, and I work within the Centre for Society and Mental Health. What's really great about this role in global health and social medicine is the ability to be focusing on, really practical, real-world research topics that stand the chance of making a difference to people's real lives, but also with that really reflective, theoretical and methodological focus as well, and that time and space to think and develop my understanding of concepts and then bring that all together in projects that stand a chance of having some real impact in the world and hopefully improving people's quality of life. I really just came into research through a love of doing research, doing analysis. I've always liked sort of organising data, numbers, words, and my first degree was in linguistics and educational studies. So I really enjoyed the little research projects that you do as an undergrad. You can get your teeth in some proper data collection and analysis, depending on what courses you take. While I was at the Social Policy Research Unit, most of my work was around the themes of welfare, employment and social security benefits. So we did contract research for the Department for Work and Pensions in the main, doing evaluations of different initiatives to try and support people back into work when they'd had health problems or long-term disabilities. In about 2007, we were asked to do a project around mental health and employment. And although I'd always loved research, this was the first project that really fired up a sort of a deep interest in me around mental health, and suddenly found myself properly fascinated by all the topics and issues that raised. So the project that we were asked to do was interviewing people who had experience of claiming incapacity benefits, as they were then called, due to mental health problems. And then closely following from that, DWP asked us to do a sort of sister project, which was with people who'd stayed in work alongside experiences of mental distress and mental health problems. What really started to fire this interest in me, what is mental health? What really makes a difference? And those projects really showed it was a real combination of sort of structural factors, organisational factors, individual and interpersonal. By working on those projects gave me a bit of a time to start looking into this whole idea of what is mental health, and as a human experience, what are we talking about when we use this very broad umbrella term of mental health problems? And in the years since doing that project, I've been able to continue to work in those areas of research and start to explore those questions and learn a lot. I saw a job advertised at the Centre for Society and Mental Health based at King's, which I couldn't quite believe it when I read the spec. I sort of had to pinch myself because it was bringing together, the job role was bringing together all of the things that I'd been so fascinated by and been working on for sort of the past 10, 15 years. And what I'm really appreciating now about the role at King's and in global health and social medicine is having that time to really delve into some of these more theoretical and conceptual issues around what is mental health. We use that term mental health or mental health problems now to talk about so many things, and it's become very current. We talk about mental well-being, we're talking about children and young people's well-being in schools, but then that spectrum goes right through to thinking about people who experience sort of severe mental health problems, psychoses, bipolar disorder. So the term is getting used to cover a whole range of things, and I think in my work it's really important to unpick what we're talking about at any given time if we're going to be able to move forward and support people on different aspects of that continuum. Thinking about how do the ways that we understand mental health then affect people's experience in the world. Does thinking about mental health as an illness, as a medical condition, affect somebody in one way if they're trying to get back into work, or if we think about it as a social experience and our well-being as being influenced by social rather than biological factors, does that have a bearing on the best ways to try and respond and support somebody who's struggling in the workplace or struggling in school or in their wider life in a community? I do have my own sort of personal lived experience of mental health problems at different points in my life. They obviously give me some insight into some people's experiences, but actually more what it does is make me realise that everyone's experience is unique, and you can't ever presume to understand what somebody else has lived through. And it just really helps to remind me always to be, listening carefully to what people say about their own experience, and not make any assumptions, and not to presume what anybody else has lived through, and to always go into research, and particularly qualitative research, which is the methods that I use, just to be listening and let people's voices be heard through the research. So my work at the moment in GHSM and in the Centre for Society and Mental Health is looking at narratives of mental health and mental illness and distress more broadly conceptualised. I'm really interested in unpicking this term mental health or mental health problems and what it is that lies beneath that term. So when people talk about struggling with their mental health or having mental health problems. What does that mean to people and how are they living that? So I'll be using narrative methods to work with people who have experience of unemployment, worklessness, benefit receipt because of mental health, to try and get their stories on how they arrive at that place, how they see that unfolding in their life. And then always trying to bring that back to a practical applied focus on what can this teach us for ways that we might be able to improve the way that the benefit system works, how it supports people, how people can be helped to be living a life that is meaningful and happy and okay for them. I came into this job mostly through applied policy focused research, and I think that will always be part of what drives me as to improvements. But I think what I'm really enjoying about being in GHSM is that real balance of applied work, but also theoretical work. So that there's time and space to speak with other, really interesting, really intelligent people about concepts and theories. And at the same time, where I am in the Centre for Society and Mental Health, also be always thinking about impact and how can we take our research back into the real world. One of the things that's been so interesting and enriching working in the department is this partnership with the Institute of Psychiatry. We've got people who've got a clinical background, people with psychiatry, psychology, working with people in global health and social medicine, bringing the real sort of sociological perspective. So I'm learning a huge amount and benefiting from all those different perspectives. And there's a real willingness and a real drive for people to work together and see how we can discover more by working together, really bringing together those different disciplines and the different insights you can get by using different methods. So it's a really sort of rich and interesting place to work. There's people in this department working on such a vast range of things, and I've learned so much since coming here. Everybody is passionate about what they do. There's such an inspiring range of topics, things I'd never come across before, and they all fit together really well. There's so much to learn, and it is really such a stimulating place to be working.